Good afternoon, teammates. Dennis LeMaster here, and I'm joined again with Dr. Pierce in our next iteration of a series of updates to keep you informed on the latest of how the Medical Center of Excellence is combating COVID. We've put a lot of focus on telework. This gets to achieving the social distancing effect, and I want to read to you a couple sentences from the Defense Threat Reduction Agency telework study, which they did. And I think the results are powerful with why, and explaining why we have a telework policy and why social distancing is important. And I'll just read it from the summary. Their results said, and I quote, teleworking potentially saves up to 35 lives and 2,300 infections, considering a population of nearly 2,800 employees who are teleworking for a 90-day period under current infection rates. That's very interesting. That's 35 lives that would be saved under the current rates of infection if they're teleworking for up to 90 days. We're going to continue our telework policy and our emphasis on social distancing, but that's some of the math behind why social distancing is so important. So to give you an update, I know that everybody's number one concern is how our teammates doing who was positive. They're doing much better, and they're coming out of this. Right now, we only have the one positive case, and no other cases have tested positive, and we are awaiting some results. Roughly half are back, and they're all negative results. Our mission continues. Army has continued to adjust its guidance on how we train the force in a COVID environment, and TRADOC is working some of its adjusted guidance as well. And once that guidance comes out, I'll keep you informed. But there has been two things which have come out recently, which are significant in how we do our training mission. One, a unit type, platoon type, company type training is going to cease. And so we canceled an FTX, and also we've canceled PT until we get a good definition of conducting social distancing training in, I got that wrong. Social distance enabled training, a socially distance enabled training environment. I wrote it backwards on my notes, but that's what TRADOC is working with, is that definition of what training is in a social distance enabled training environment. And once we get the parameters of that, we'll continue to train. But again, out of an abundance of caution, we're going to maintain the distancing policy as best as we can and still keep the training effect. So more to follow. Just before I came down here, I got a note from my friend and colleague, Brigadier General Wendy Harder, who, as you know, commands Brooke Army Medical Center. And this is a request from their staff. If you're feeling sick, stay home. And that we know that some of our teammates have, even though they've been feeling ill, have come to work out of sense of mission and responsibility. But I would ask that we take the larger picture and look at the long-term view and stay home if we're not feeling well. So there's a nurse advice line, and the phone number is 210-581-2266, option 6, to call that line. That's the nurse advice line at 210-581-2266, and hit option 6 to book an appointment or for home care instructions. So if you're feeling sick, stay home. Remember, coronavirus is very contagious. So I think that's my update from my foxhole at this point. I would like to offer Dr. Pierce a chance to make some comments if you have anything new from the clinical side.
I think, sir, the main thing that I'd like to say is just to put a thanks out to all of those who are teleworking at home and continuing to assist all of us with the mission and the fight here at the MEDCoE. And then a thank you to all of those of you who are here still working and training our service members and civilians here. I've seen wonderful examples and creative examples of social distancing while still maintaining training. And so it's really been wonderful to see us maintaining the mission and still fighting coronavirus at the same time.
Thank you.
Yes.
So we'll take some questions now.
Okay, sir, the first question is a follow-up from the first live virtual town hall session we had. and it bears repeating because of some of the follow-up responses we had. Why are we still training even though the mayor issued a stay-home, work-safe order for residents?
So, excellent question. The mission continues. Two words which I say often, and until we get a stop mission or a change of mission order, we're going to continue to do this, but we're going to do our mission in a socially distant environment. So another point to remember, the mayor made a great decision, and it's really good for the city of San Antonio. But we're a federal entity, we're a DOD entity, and local directives don't apply to us because we have a federal mission that we have to accomplish.
Thank you, sir. Another question we just received is, if PT is suspended, what does that mean for graduation requirements for AIT?
So there'll be adjustments made. And I just kind of ask that we all be patient and take a pause for a moment. We're not going to paint anybody into a corner and not set them up for success. And of course, this could go for a long time. The Army will make adjustments for a variety of different graduation requirements, no matter whether it's for physical training or for graduation certificate completion, what have you. Just bear with us, and as soon as we know what the rules are and what we got to do, we'll inform the force.
Great. This next question is for Dr. Pierce. I know that you wanted to follow up on a question that we had during the last Facebook Live session. You were asked whether or not the virus can survive for up to 17 days on surfaces. Would you like to elaborate on your response?
Yes, thank you so much for bringing that up again. And after that Facebook Live session, I have heard that several times, either in various news articles or just having folks asking me that via email or in the hallway if I see them. And so I really wanted to drill down into that just a little bit more to give everybody kind of what's the real information behind that. So the short answer to that question is no. At this time, we don't really have that understanding that the COVID-19 virus can infect us from surfaces up to 17 days. So where did that even come from is the next question. And so the article that came out of was from the MMWR, which is put out by the Centers for Disease Control. And the article that was mentioned in actually wasn't even about looking at research about surfaces and how it persisted. It was really looking at the transmission on cruise ships between the passengers and the crew. And if you went all the way down to the bottom, there was about 2 or 3 lines in that article. And what it basically said is that in the investigation that the individuals were doing on the cruise ship, they found that up to 17 days after individuals had left their rooms, when they were investigating the rooms and testing them, they had found some viral RNA. And so what that basically means is that they found pieces of the virus that they were able to identify were from the COVID-19 virus, but it doesn't mean that that was enough of a virus that it was a full particle, and it doesn't mean that it could actually infect anybody. All it means is that they were able to identify it. A good way to think of it is if you went into a room and you saw a hubcap and a hood from a car and perhaps maybe one of the tires, you might be able to say, well, looking at all those pieces, that looks like a silver Ford F-150 to me, maybe from the past 5 years. You can identify it, but it doesn't mean you can drive that vehicle. So it's kind of the same idea. They're able to identify that virus and that it was there, but it doesn't mean that virus is able to actually infect anybody. The best study that we probably have so far is a different one that came out from the New England Journal of Medicine, and that kind of shows us that at least in very controlled lab settings, it can survive about 2 to 3 days on hard surfaces like stainless steel or hard plastics and things like that. Other surfaces that might be softer, like this surface here, are much a shorter period of time, closer to less than 24 hours. So I just wanted to remind you again that even that study, while probably closer to right, was still in perfect lab conditions. And so when it's out in the environment, it may be even less than that.
Thank you so much.
Sure.
So, sir, there's a few more questions about AIT that I think we can combine them. They're asking, are we taking soldiers from BCT for AIT? And another question about if we're expediting training for the IET and AIT soldiers. So perhaps if you could explain our role in the pipeline from
All right,
BCT to AIT.
great questions. And I know all those questions are from concerned citizens, and their number one issue is readiness, and readiness of the force, readiness of the Army, and defense of our nation. So the pipeline continues. In fact, we're going to get about 200 plus soldiers coming from Fort Sill here next week, and they will be going through their AIT training with the 68 Whiskey program. Right now, we are not accelerating any courses. That's the truth for this moment in time. That could change for some MOSs and AOCs based upon the demand on what our nation needs for professionals out in our hospitals if this situation nationally becomes worse. But at this moment in time, the POIs are remaining unchanged.
Thank you, sir. And that brings up the next question. I think the next obvious question, with the stop movement in place, the pipeline still open. So the question is, really, you sort of answered it in the last town hall, but for those people who weren't tuned in, what housing adjustments will be made, if known, when we will continue to receive soldiers but keep the active duty soldiers and or the ones who are currently in training?
Okay. So we currently have enough building space to take more soldiers on and fill up the rooms. The rooms are still going to be filled to their current capacities. But we're going to hit a red line here in early May if we don't graduate. I know our soldiers are all going to graduate, but once they graduate, if they don't go on to their first duty assignment out in the force. So what I would tell you is we're working with TRADOC and Joint Base San Antonio on what our hard stop deadline is how many soldiers that we can house safely here on Fort Sam Houston.
Thank you, sir. Dr. Pierce, this is for you. It's about that third-party contact that I think you were discussing last time a bit. I was in class with someone who later found out that they had been in contact with someone who was COVID-19 positive. My classmate is now under conditional release for 14 days, but asymptomatic. Should I also go into conditional release or quarantine?
So I can understand everybody's worry about potential exposures to COVID-19, and everyone is very mindful, I think, at this time of wanting to make sure that they're doing the right thing for themselves and also for all of their office mates and classmates around them and their family members. In the case that we've just described, though, for you, your classmate, it sounds like, was not a case and was asymptomatic, so wasn't having any kind of other types of respiratory symptoms. And so that places you into kind of the contact of a contact situation. And so in that category, there's really no guidance at this time or indication for you to need to stay home. I think the things that we can tell you to do are those things that we encourage everybody to do right now, which is maintaining our social distancing and really being mindful and alert of ourselves. Whether you feel like you're getting sick, if you think you're coming down with something, that's the time to make sure, hey, maybe I should stay home today and take some time to get myself rested and monitor yourself for symptoms.
Okay, thank you. And another follow-up for the medical side that we just got live. If a soldier has recently recovered from pneumonia, should they be concerned about having a higher chance of contracting COVID-19?
So that's a really good question. So I have not seen any research that would support that. Certainly if someone has made a full recovery and otherwise previous to having pneumonia didn't have any other existing, pre-existing chronic respiratory conditions, I would say that as long as the individual had made a full recovery, then that might not place you at increased risk. But certainly in the setting of having one illness, especially one respiratory illness, that does place us in general at risk for just any additional kind of insults from additional germs and things like that. So I think the best advice is if you are already trying to deal with one illness, trying to make sure you keep yourself just as healthy as you possibly can, and maintaining all of those hygiene guidances that we've put out, making sure that you and anyone who might be a caretaker for you is washing hands and maintaining hygiene. And that's the best way to keep everybody safe, I think.
Okay, thank you.
Sure.
So this is a question, sir, that we received, actually we've received many times, and even at the last JBSA town hall. Is the Army going to relax grooming standards listed in AR 670-1 on haircuts, since you cannot get a haircut and remain within proper social distancing guidelines?
So we're still maintaining our current grooming standards. We haven't gone to COVID positive or COVID grooming standards yet. When we do, we'll let you know. Our barbers are instructed to maintain strict protocols and observe the social distancing as much as they can, but of course, this is going to require a hand with scissors to get close. So there is some risk, but we're working to minimize the risk. Once our leadership decides that the risk is too great and they opt to modify our grooming standards, then we'll let you know. But in the meantime, the barbershops are still open and we need to have haircuts.
Thank you, sir. So another follow-up, and again, I know we got this also at the JBSA town hall the other day, with the announcement that the Air Force's basic military training course at JBSA Laughlin had their first positive COVID-19 for a new recruit. How confident are you that our AIT pipeline is still safe?
So I'm confident. One of the things we're working, I mentioned a moment ago about 200 or so trainees that we're going to get from Fort Sill. These soldiers are going to be transported on sterile means, all right? Their buses are going to be wiped down and they're going to be filled to half capacity so that the soldiers can observe social distancing inside the bus. Then once they arrive here, they're going to go through a screening process again, and if any of them are feeling ill, they will go down to Brooke Army Medical Center and get taken care of. For those who aren't feeling any symptoms, they'll go right into training. I'm still confident in our systems. Remind you, we've only had one COVID positive teammate thus far. Our student population is not exhibiting any symptoms. We're doing the right thing so far, and I really hope this trend continues.
Thank you, sir. So we have a question, this came in live. Will distance learning take place? So maybe a chance to reiterate your position on telework and those processes.
Right. So distance learning, we're doing it now as we speak. Some of the courses are already being done virtually via Blackboard. Some of the courses, almost all their content, for example, the 68 Charlies, the licensed practical nurse curriculum, is entirely digitized. We're working on the 68 Whiskey for complete digitization of that, as well as the Basic Officer Leader course and the Captain's Career course. My priorities for digitization are those four: Basic Officer Leader course, Captain's Career course, 68 Whiskey, and 68 Charlie. And we're getting there. We got some folks working real hard to make this happen. Ultimately, what we want to do is get to so the content is out there for all our students to be doing digitized or online training.
Great, sir. And ma'am, you being an instructor, do you have any other tips in that area?
I think that really, I just underscore what was already said. Certainly, each of the areas of curriculum are taking great strides in order to ensure that if they have training that would require to be in person, they're observing social distancing and dispersing groups as much as possible. And then for the vast majority of training, from what I've seen, just being here in the hallways, it looks like a lot of training is transitioning to distance learning. I know many of the courses that I would be an instructor into, I'm now wearing a headset or talking into the phone to record my lectures.
So here's a question we received live. Are all soldiers arriving being placed in a 14-day quarantine, and either one can take it, but I know it depends on the locality that they're coming from?
It does. So in a sense, that's a difficult question to answer for every individual. So those individuals who would be coming from higher risk states, would be placed into a restriction of movement, a conditional release type situation for 14 days. And then certainly any individual who would report that they are a contact of a case, a laboratory confirmed COVID-19 case, those individuals also would need to go into a 14-day quarantine. And then in addition, any individual who would present for a course who would be symptomatic, that would be another situation where we would certainly have them proceed to Brooke Army Medical Center, ensure that they're getting care and getting evaluated. But if they are tested or not, at least initially, that individual would also need to go into an isolation type situation. So, but it's not a one-size-fits-all. We have to look at each group and each population and where they're coming from, and then kind of make that assessment at that time.
Okay, great. And sir, this is not a unique concept of a question. We often get on our Facebooks or other social media an instant where a parent says, "My soldier said," so right.
Mm-hmm.
So we're going to take it with a grain of salt. But this person writes, "My soldier says there's not enough cleaning supplies in the AIT housing building. Can we remedy this?" And whenever we get these without the general in the room, we always tell them, "Hey, we need more info." We give them our email address so they can come back and give us more details so we can look into it. But what say you, sir?
I'm a parent too. And it came from our kids, it's got to be the truth. Well,
Right.
In this case, there's a lot of truth behind this one. So remember now, our entire national supply systems are being hit at once for all the cleaning supplies.
Right.
We are starting to show movement on some of these supplies, and when they come in, we distribute them about. And we've been able to make a lot of smaller quantity purchases through a variety of different venues. And they've been coming in, and we've been working with Joint Base San Antonio as well as our North to get these. They're starting to trickle in. Now, what I can tell you, when the manufacturing base and the logistical system gets moving, ramped up full speed on something, then all of a sudden a lot of it comes in. We're getting 600 gallons of hand sanitizer next week. That's what's projected to come in. That's a lot. We know that PPE, masks, buckets, mops, Clorox, and whatnot will be coming in as well. We're not totally out of supplies. We're consuming a lot of supplies. And I would say we've just barely got our head above water, but the help is on the way. Good question.
Thank you, sir. So here's one, and again, it might be one of these we don't know yet, but I will go ahead and ask it. Are they going to push back all AOC courses for nurse corps, such as ICU, ED, or OR courses due to the COVID? Or do we know?
So right now, we don't know yet. And we're on a pause. And this could, of course, change our current scheduling, but we will let everybody know when that happens.
Okay. So they're asking, again, when soldiers depart, if we know that if people are departing after AIT, do we know how they're going to depart? After we get the all clear, business as usual as far as our normal exit plan for clearing soldiers?
So our number one priority is to protect the force. We know that COVID is not going to go away on a certain date in the calendar in the future. It's probably going to decrease gradually over time in certain locations and maybe followed by increases in transmission and then decrease again. That's what we're thinking will happen. We're going to release our soldiers in a way that protects their health. Right now, well, let me back up a little bit. Before COVID, soldiers would go to the airport and get on a plane and go to the next duty station. Not sure whether this is going to happen in the future. I had talked about sterile transportation, but the airline industry has to be safe. Their destination of where they're going to has to be safe, and they got to be healthy to go. So more to follow on this, but I guarantee you we're watching it close.
Thank you, sir. And in the interest of time, if you would like to make some closing remarks, I'll turn it over to both of you.
Sure. Go ahead.
So one thing that didn't get asked, but is something that I just want to take a few minutes, because it's another thing that I've heard kind of going around the hallways, and just I get questions about it. And one of those is is COVID-19 going to come through my HVAC system? And this is, I think, one of those things where if you have someone who's a COVID-19 patient in your home, or just you're generally concerned about protecting yourself, your family, and your office mates, it's natural to wonder about that. And so I just wanted to take a minute to reassure you and to discuss again or reiterate what we talked about in those education sessions that we covered several weeks ago. And one of those is that, first of all, the way COVID-19 is transmitted is either by direct contact or by those respiratory droplets. And those of you who saw my education sessions, you may remember when I mentioned those respiratory juices. So that's what we're really talking about. And that's why social distancing is so important, because those juices, if you will, can't really travel very far. 6 feet is really the extent of how far they go. Really, in general, it's about 3 feet. But we say 6 feet out of the abundance of caution to make sure we're out of that range. So only very few types of viruses, like measles or tuberculosis, a bacteria, can actually travel and be transmitted through the air and may end up in your HVAC system. But rest assured, COVID-19 is not one of those. Sir?
Okay, thank you. It's a great point.
Thank you.
Hey, teammates, keep the questions coming. We're going to be doing this iteratively at least once a week. Once information changes, or if we put out something that wasn't quite accurate, we're going to get on here and make it and update you and correct anything we put out. Our mission continues. Let's continue to be calm. Our rates of transmission right now are very favorable within the Medical Center of Excellence population. Let's keep that up. Clearly, your hard work in following social distancing policy is having the positive effects. I'm proud of you. We'll see you on the high ground.